This is Duncan Turner from the Vagina Doctor podcast. Welcome to the Consult With Me segment where we take a deeper look into our most frequently asked questions. But what do I know? I'm just a vagina doctor.
So our short today is about PCOS, which really should be a long format episode. And we're going to get to that later in the year with a specialist and a patient, by the way. But today I just want you to chat about PCOS and kind of go into it briefly.
Okay, well, this whole subject, actually a syndrome, was recognized probably about 100 years ago by Drs. Stein and Leventhal. And they described a syndrome of irregular menstruation, obesity, hirsutism, and infertility. And more recently, it has been, because it has been really an enigma. It's been a strange topic. We still don't understand it. And what we have come to believe or to understand is its close association with diabetes and abnormal glucose metabolism.
So for young patients that are positive for PCOS, and we're looking at preventative for diabetes, right? You can kind of look into the future, and this patient is going to present with this later in life, so they can...
High risk of it. Yeah.
High risk, okay.
And
that's good information.
Yeah, it really is. And it's... I think it's being recognized more and more these days, and that's really just awareness of physicians of thinking about this. There's no really distinct blood test that can be done to make the diagnosis. It's a syndrome, and which means a variety of symptoms, some or all of which some people have, and so the thought comes up from time to time to make the diagnosis. Pretty much on almost all people's, all investigators' opinions, it's a matter of hirsutism being part of it, and that's variable because some of that is just genetic and is increased in some ethnic groups without it being pathological at all. But basically, it is what Stein and Leventhal said that many years ago. We don't quite see it so much with the obesity these days. But nevertheless, it's serious because we're not sure if it's an ovarian problem or a diabetes or carbohydrate metabolism problem or which way it starts.
And these patients usually come to us because they're complaining of breakouts, hair loss, and
just not feeling well.
Right, fatigue.
Yeah.
Yeah.
Right. And some irregularity of periods, which is very common anyway for teenagers. So it's something that needs to be paid attention to. I encourage patients to go to somebody that deals with this quite a lot because it is complex.
So what kind of physician would that be?
A reproductive endocrinologist, meaning that's an infertility specialist who comes from a background of endocrine disease, and then just people with a lot of experience in looking at PCOS. And we've had all sorts of different treatments for it over the years. Medication, surgery, quite surprising surgery sometimes when one treatment was called a wedge resection, where surgically a portion of each ovary was removed to decrease the hormone activity of that particular ovary. And that helped a lot of people. But there's no overall easy answer to this. So it is complex. It's hard to make the diagnosis. It's hard to treat. It can just be nutritional treatment, can be hormonal treatment. As I've said, can be surgical treatment.
But it is a lifelong condition, right?
Yes.
Okay.
Yes.
All right. Great. Well, we're going
More to come.
We're going to get that expert on really soon
Yep.
to give us more info. Thanks for listening. And if you have more questions, please let us know either by email or DM us on the Vagina Doctor podcast.
See you in the next episode. The Vagina Doctor podcast. It all starts here.